I want to go back and catch it early. It's a huge indicator if with someone's mental health, if they're having behavioral problems in school, it's a huge indicator whether they're going to find themselves in the prison system. Okay, and a lot of the times this is happening because these children's needs aren't being met, whether it's emotional, whether it's financial, whether they're hungry or not. So what I want to do is provide from an early age a resource, give them a solid, concrete foundation to have folks taking care of them. I've had school board members and teachers. I'm endorsed by the Lynchburg Educators Association that said universal pre-K would be a great idea because number one, we're always talking about how our schools aren't filled enough. Okay, let's fill them. Kids. We've already added pre-K 3 and 4 last year, and there's a waiting list a mile long. The more structure we can give these kids from an early age sets them on a course, not only for success or achieving their dreams, but it also gives them a concrete foundation about what's going on up here.
Working in the field is not just a Lynchburg issue, it's across the country. We have already in our city great healthcare opportunities. We have great providers such as Central Health that's opened a new mental health section, I would call it program, where people who are experiencing crisis can go there rather than being housed in the emergency area. They're offering a special opportunity and program for those folks. Also working with other local nonprofits such as Horizon Behavioral Health, who work with our public safety, Community Access Network, Johnson Health, and others who provide mental health services. It is never enough, so increasing our opportunity and support for recovery programs, for mental health programs, working with our local mental health providers is one way we have to do it. We had a healthcare and mental health committee which worked with the Bridges to Progress to see what are the needs. Sometimes it's a medication issue for folks. They may not have persons who are able to work with them on their medications. Sometimes it's deeper than that, and folks need facilities and places to wind down and have that personal professional time with people. We have to recognize that as a city, we have limited resources to provide, but as community collaborators and partners, we can provide services if they're well thought of.
I will say that we, as I mentioned, we have some incredible partners in the community. Horizon, Johnson Health Center, Centra, that are doing a lot of this really important work. But there are obviously, for a host of reasons, a lot of it has to do with money, folks aren't able to access the care that they need. And a lot of this happens, at the federal level, right? It happens with Medicare, it happens with Medicaid. I mean, these are big challenges, right? So what can we do as a community? Well, there are certain things like increasing the number of, and I mentioned this a moment ago, increasing the number of counselors and social workers that we have available to, especially to students, is key. But it also, I think, means a lot of just very determined advocacy at the state level, right? So the state level controls our largest mental health institutions. They also write the laws about how many beds, really, we have available for us in the state. And there are real consequences, of course. There's both the very human consequence of not having access to care, which is a tragedy, but then there's like the societal consequence, right? What does it mean if we have police officers who are doing ECOs or TDOs who are unable to fulfill their duties because they're spending 24, 48 hours sitting with a patient when they otherwise might be out on the street doing the job that we hired them to do, right? So there are these just an unbelievable number of downstream consequences, and they're the economic cost of untreated mental health is astronomical. The statistics, which I don't have in front of me, are
a massive issue, and I will agree with one thing, that it's not Lynchburg specific. But where I will differ is I'm going to say that we as a city are the most poised to wrap ourselves around our community, probably more than any other city in the nation. The reason I say this is because Lynchburg is a city full of service, right? From our college students who are willing to host panels for candidates to come up and speak, To the individuals even sitting up here that have decided to take a step out today, we are a city that has a plethora of nonprofits and a plethora of volunteers. The fact that we're not partnering with them as much as we could be is a shame. I want to highlight something that Bo said that I very much agree with, which is he highlighted in the last question how our nonprofits have stepped in to help with affordable food. That same thing can be done for our mental health crisis. And it's, like Tremaine said, not just here. But I think it's important for us to recognize that it does go to every single facet of our city. Our college students, let's not act like we've not been left behind in terms of mental health with COVID, right? COVID has affected us all in such a great way post coming out of the pandemic with our mental health crisis. And it's time for us to be able to take autonomy over that. It's time for us to be able to have nonprofits partner alongside us in that and find these practical answers for how individuals can feel valued, loved, cared for, and safe moving forward.